Janet, can you mute her? Okay. So I know that, of course, everybody is, there's more than enough to discuss the vaccine boosters. I will show a couple of slides, and let's do our usual thing, which is do put questions into the chat, okay? It's choppy, right? Yeah. Yeah, I'm not sure I can fix this. Well, I'm gonna discontinue. I'm gonna turn that better. How is the sound? Can I get somebody to confirm that it's a little better?
Hi, Misha. Yeah, it's better.
Okay, great. All right, and then I'm going to force quit the Google Chrome as well. Okay, that should help a lot. All right. So boosters, I know a lot of people have been emailing me and sending me messages saying, how can I get a booster? Well, you really cannot. CDC is very clear, boosters not authorized, there's no data. There's an expectations of boosters to be available in an upcoming weeks. It has nothing to do with lack of vaccines. It basically has to do with the fact that there's no research. So we don't know if boosters going to do anything. We are, of course, know that the boosters will increase risk of side effects. There's no question about it. Since basically it'll be, if you're taking the same booster, it will be like as if you're getting a third vaccine. And those of you who remember second vaccine, especially with Pfizer and Moderna, had more side effects. My personal intuitive sense, and I have nothing to support this by, that it would be way more important to get an alternative vaccine. So if you got a Pfizer, is to get a Johnson & Johnson. If you had Johnson & Johnson, to get a Pfizer. Why am I stating this? I'm basing this on one thing. First of all, it appears from everything I see that there's a statements that 6 months out, effectiveness starts to decreasing and have not been proven, while antibodies do tend to start disappearing 6 months out slowly. There's just not a lot of data to say that the efficacy drops significantly. So the presence of antibody does not guarantee that, or lack of antibodies does not mean you're not protected. So that's a first big item. And I am worried about consequent injections and side effects. Hence, I expect that if you take an alternative vaccine, that you will have a lower risk of side effects. So now, it's not based on anything. I know there are several studies ongoing. We should have an answer to this question shortly. Okay, I have a short slide presentation for everybody, and this is courtesy of Dr. Axelrod, who is the lead GW Medical Faculty Associates expert on the topic. So let's see if that's gonna work. Okay, can you guys see my screen? I see some people.
Yes.
Okay, good. So I'm gonna just keep it simple like this. The couple of things I want to show is, I'm gonna skip a few of these things. So this is one really important slide. So this is Virginia cases by vaccination status. Everybody, of course, have heard now that in Massachusetts, there was an outbreak of 400 plus patients where 75% of patients had been vaccinated. So majority of patients who developed COVID actually have been vaccinated, and most of those were vaccinated with Pfizer. It's confusing and almost irrelevant. Why? Because there was just a small area. Most of those people were relatively young, and the thinking is that they were all exposed in a very tightly packed bars during just outing. So it doesn't mean that 75% of everybody who's vaccinated going to get COVID, right? In fact, if you look at this slide, you see that it's a tiny, tiny minority of patients who are vaccinated overall are getting COVID. So I think the vaccines are still highly protective overall. They're not as effective as we would want them to be, but they're still very effective. And you can see that while the sort of total percent have dropped somewhat, that drop is very, very small. So, okay. Here's very important issue. So this is the only study that's currently been not just published, but peer-reviewed already, even though it's still in medRxiv, which is not peer-review website. So the B16172 is the Delta. So there have been cases in the studies that appear to be, and this is a mostly mRNA. So you can see that majority of patients have been vaccinated with mRNA and only few with non-mRNA. So the vaccine still in controlled study is highly, highly protective. So, you know, it is lower than with the prior strain. So the other big problem with the Delta, the new data, and I don't think I have a slide for that, the Delta is 1,000 times more effective, more infectious compared to the original strain, the first COVID that came out, and about twice more, 100% more infectious than the English alpha variant. So it is more infectious, it is more severe. Vaccines do still somewhat work. However, we're gonna be in the next probably 2 to 4 weeks, we'll have a very good sense where is this all going. I don't know if the booster is gonna make a big dent. So let me show you a couple of other things. If anybody is interested, we can probably share a few of the slides. So this is the up-to-date NIH guidelines for the treatment in non-hospital and in-hospital. There's not been any changes really. I do want to say that. I'm going to skip this. Okay, so are the breakthrough cases a problem? So this is basically the key question. And it appears that they're only a problem because they're keeping the virus alive, not necessarily because they somewhat dramatically increasing rates of mortality or altering how the healthcare workers are working. So it's still a very, very low risk for those of us caring for patients and on the front lines. And that's probably the most important message from the Israeli data. So, all right. Boosters are seemingly necessary for what appears to be most important for people on organ transplant. So you can see on this slide that the percent response tends to drop out pretty quickly, much lower compared to the cancer, hemodialysis, and immunosuppressive therapies. Interestingly, if you're on a hemodialysis, there's basically, it's very comparable data to a non-immune compromised patients. Cancer and immunosuppressive therapy is somewhat lower, but really the biggest problem is organ transplant. So currently the CDC is likely going to approve organ transplants in the next week or two for boosters right away, just because of this specific data. So this is the current recs. You know, there's no recommendation. However, if clinician can make an individual assessment of their patient and decide positively on a booster based on a discussion with the patient despite lack of data, and that's based on the prior slide, and basically it just refers to patients who are somehow immune compromised with exclusion of hemodialysis, because there doesn't seem to be a data of a decline of efficacy of the vaccines. And of course, I've already heard at least from 2 of my patients asking, where can I get a booster? Well, you really can't. You know, it's sort of simply saying you're going to have to talk to your doctor and decide if it's for you. But you can get it as a part of the clinical trial, and this is the data. So GW does have a booster vaccine. It is open for everybody over age of 18. The only criteria that you have to be fully vaccinated with authorized COVID vaccine. And you know, you have to you're going to have 6 study visits for 1 year. There will be compensation for time and travel. I don't actually know exactly what you're going to get, but I'm assuming you're going to get mRNA vaccine, not the Johnson & Johnson, although I don't know that for sure. We will definitely put this slide in our at the end of the talk. So those of you, I'll leave this slide for a minute or 2 on the screen if you want to take the phone number in the email. And this is on campus, so this is at GW. Okay, so let me take a look about the questions. Okay, Novavax, yes, update, forget it, not happening. And I'm telling you this officially and unofficially. Do not wait for Novavax. There is no expectations it will be approved in the United States. They're likely going to get international approval, but they will be prohibited from the US market. I cannot tell you how I know this. That's all I'm going to say. And I don't expect that this is going to change. So it's not about delaying of submission. And again, I'm not going to say more than that. It's a lot more complicated than that. There's nothing they can submit in essence. That's where it comes down to. They're not in compliance with most of the regulatory states for the United States market, from what I understand. So, okay, let's see. Can you comment on the latest Delta Plus variant out there? Yeah, we'll be hearing more about it. We are expecting, of course, and there's new information that Delta mutates. It's all expected, right? How it was going to go, I don't know. Worry about it. No, worry about the Delta period. Whether Delta Plus is a bigger problem, who knows? Right now, it's over 80% of all the cases in US of Delta. I was giving a talk on Sputnik Radio, I think this Wednesday, and they asked very great question. How do you know what percent of Delta is? Like, the tests are not clinically available for practicing physicians, so it's all research-based questions. Well, we do know they're doing what's called a random sampling, so it's actually pretty accurate, because if you take in a given area, you randomly pick, say, 100 positive patients for the variant testing, the expectations are that you're probably going to be pretty accurate at representing a larger pool. So I want to do comment on that. Well, I'm actually quite efficient today, so I'm going to take this off the screen. And I guess I'm going to open up for anybody to keep going with the questions, but also if anybody wants to comment on anything. And oh, that's nice. We're hearing someone's kid. Must be Jennifer's grandkids. That's nice. In terms of the wellness, I wasn't preparing anything. And Sheila raised the hand. So Sheila, go ahead, if you don't mind. Go ahead and unmute yourself. And
I wanted to make a comment relative to those that are getting reinfected who have been vaccinated, especially in that Massachusetts situation. They don't give you enough information relative to those who are reinfected. Like you said, some were in bars. We don't know if they had on masks. We don't know
correct
about the age. There's a lot of unknowns that could make that group, especially since it was a big group, a festival type thing or whatever. It could have left them more exposed to the situation as opposed to those who had on masks and who were distanced and all of that, because the basics still apply to me. If you're not trying to get infected, you still need to do the basic things.
So I think, Sheila, it's 100% accurate what you're just saying. And I think that's why I wanted to, let me go back to this slide because it highlights the importance of understanding this statistically. So this is the much better information here. So this is the breakthrough cases that were in healthcare workers in Israel since January. The importance is that these people were using appropriate protective gear. Now, they were not using the full gear because the expectations were that once you're vaccinated, you can just wear a surgical mask and you don't need even eye protection. So that was their standard in this assessment. And you can see that the breakthrough rate was 2.6%. And most of this, actually all of those cases were mild, 33% were asymptomatic, meaning patients didn't even know they had a disease. They were just screened and found positive nasal swab, nasal PCR swab. Yeah, these were younger patients. And again, of course, this is a healthcare worker, so you would expect them to be a little bit younger. And so yeah, we will probably going to have a lot more data in an upcoming weeks. This is not a US data. Can we fully compare our population to Israeli? It's probably anybody's guess. I would say that's probably relative comparison to only some subpopulations of Americans, but nonetheless, that's the best we have. So thank you, Sheila. That's a great point. Anybody else? All right, I do want to bring up one other point, which is actually, Judy, you just read my mind. Okay, so I want to talk about indoors versus outdoors, and then masks versus no masks. So you just perfect timing of question. And Anne, let me answer your question first. So Delta spreads everywhere. The point being is outdoors, the risk is still tiny. So even though it's a lot more contagious, but the reality is, from what we can glimpse from the Massachusetts experience, all of those transmissions were from indoors. Not only that, all patients who got positive there, they were all basically stuck in a way overcrowded bar. The bar was over capacity. There's been some stuff going on with figuring out if this was even legal, what they were, how many people they allowed. There was absolutely no distancing, no masking. So bottom line, I think that wearing masks outside is not warranted. I think the CDC seems to agree with this. Of course, everybody have heard that at least DC now gonna, as of July 31st, mandating the masks indoors. Most of the healthcare facilities, well, actually all healthcare facilities in DC maintain masking indoors for everybody. I would say, I think it's really important that if you are with the people you don't know indoors, no matter about their vaccination status, you probably want to start considering masking. Outdoors, I don't see any reason, unless you're in a very, very crowded scenario, something like a rally or some kind of picnic gathering where you're really clumped up in a small space outdoors. But outside of those situations, hiking, jogging, anything, I can't imagine there's going to be any sizable risk. And I don't think it makes any sense to wear the mask. Okay, there's more questions. Judy, let me know if that answers your question. I would say to your specific question, visiting kids, wear masks indoors, not outdoors when you're with them. Even if you're relatively close to them outdoors, short of literally kissing them, I don't see how they're going to be a lot of risk.
And they should wear masks as well, like the 10-year-old?
Well, the great question. You know how is it really feasible asking 10-year-old to wear a mask?
Sure, I could ask.
You could try, but I don't think that's going to happen.
They're so used to wearing masks, though.
Yeah, if they can wear it indoors.
So.
I think if they can wear it indoors, I think it's fine. Okay. They're not vaccinated, of course. So that
the
is.
Younger ones aren't, no.
Right. Right. So, but, you know, again, it's a sort of a choice. If you go over there and everybody in some sort of quarantine for a while, and then you probably don't have to wear it. Quarantine meaning that you're just there for 2 weeks and, you know, wearing masks. Then after that, you probably don't have to wear it. But that's a pretty specific situation. Is it true that obese people are less protected with vaccine? So no, it's not true. Obese people are at a higher risk of a severity of illness and generally should be considered immune compromised. So they're going to have a higher chances of breakthrough, but it's not going to be, it's still going to be strong protection. It's just not going to be as strong as in people who are, you know, who are not obese. That's all. So there, it's definitely still the best tool for that we have formally, regardless of the weight. Good question. Any early data on whether post-vaccinated mild cases include long-term? Great question. I was just listening to the CDC was giving a talk on this. There is a suggestion that the answer to this question, unfortunately, is probably yes, but we don't know the sort of the extent of it or whether those long-term syndromes or symptoms are comparable in severity to unvaccinated post COVID long-term symptoms. So I think, unfortunately, chances are yes, and just we're hoping that it's going to be milder, but we can't say that for a fact. Thank you, Benita. Yes, Montgomery County is beginning to start indoor masks, and if you guys correct me if I'm wrong, I also believe that schools will require come the time for students to be everybody masked indoors, all the kids. So, Judy, that's come to your point. They will require all classes to wear masks. How's that going to work? Who knows? They're probably going to have masks not covering the noses, and God knows what. So it's an attempt to do something. Question is how effective that's going to be in somebody who doesn't know potentially how properly masks to be worn. Will the schools provide formal continuous training and oversight? I think it's everybody's guess if they will do that. Okay, Arit, it's a great question. My understanding answer is no. I have seen this been discussed. Nobody formally looked into this, but there's no expectations that Delta gonna change its contagion to include surfaces. Remember, the surfaces have basically been ruled out as a way of transmission, short of you licking your surfaces or something like that right after somebody spits. That's seemingly not a concern at the present. When a young, Anne's asking, when a young kid's getting vaccinated, I don't actually know. I know the studies are ongoing. I have even more ethical concerns with the under 12 vaccinations. There is 0 deaths in that population. So, and now, especially with the Delta being clearly as transmissible through vaccinated patients as without, there is going to be no herd immunity expected. So vaccines are only protecting you, not other people, and hence it's very unclear what's the point of vaccinating very young people, in my opinion. I think that the kids should be targetedly vaccinated. Kids who have immune deficiencies, kids who, for whatever reason, are have some care challenges, those should be discussing. Parents should discuss this with pediatricians and make a decision. But as a blank cover for all, I think it has to be voluntarily, and more importantly, I'm going to be very strongly opposing if the school's going to try to mandate vaccinations for all kids. I have a feeling it's just not going to happen. There's just going to be too much uproar if that's going to go that direction, although there are seemingly discussions about that. At least, I don't know about Maryland, but at least in other states. All right, let's do last question, and I think we're going to be right on time with that. Elizabeth asking, when my granddaughter returns from Africa for school in September, how long must we quarantine from each other before I can watch her after school? She's 9. This is a very similar question to Judy's question. I would say that I don't think you have to really quarantine here, quote unquote, unless you know that she's been exposed during the trip somehow. I think if she were to wear all the needed protection, I think you should wear the masks for both of you indoors for 2 weeks. And after that, assuming that it's fine, just move forward with removing the masks. Oh boy. Yeah, I was hoping this will not come up. I know, Susan, I'm assuming it's you, so I'll take 2 more minutes. I'm assuming that you're the one who emailed about this study to Janet. So point being of what Susan just put in there, we're now beginning to see deaths from COVID in vaccinated patients in the nursing homes. And this is why I strongly brought up a point that vaccinations for immune compromised patients or boosters probably important at this point. So there are probably 2 reasons why this is happening. First, most of the nursing home residents were vaccinated way earlier than the general public, many months, 3 to 4 months ahead. Number one, so most of those patients are probably by now, not just 6 months, but maybe at 8 to 10 months out of the vaccine. And we do know that the vaccine efficacy dropping faster in older and immune compromised patients. So that's point number 1. Point number 2, those deaths are all Delta. So we do know that the variant is more not just more contagious, but also more virulent. So yes, unfortunately, likely we will see an uptick of this. But remember, people in nursing home for a reason, right? It's expected that anybody in a nursing home is going to have an altered immune system at 100% rate. It's just the nature of why would otherwise you be in a nursing home. So stay tuned. Thanks for posting this. My expectations generally, I'm going to finish with this, is that in about 2 to 4 weeks, we'll know for a fact what is the best current recommendations on the boosters, who should be boosted, and with what. And I'm gonna, if you guys want, we can, I don't actually remember how to do the poll, and I don't know if we have time for that. You have to set this up, but I would love to see if you guys agree with me that alternating the vaccine would be the way to go. I'll see. So far, most of my predictions were correct. I'm gonna see if I'm right on this one. Probably not, but I'll make that prediction anyway. And I think with that, my time's up. I'm super excited to see my wife carrying out our continuation of mind-body practices. And Zhel, take it from here. Thank you very much.
Thank you. I'm super excited to be back here. I think it's my 4th time now. Kind of it's getting a little bit easier. So mindfulness practice, body-based. After these 30 minutes of talking about, all this stuff doesn't just, and it all means like we can't relax yet. I don't know how you guys are doing, but I'm noticing, like some almost like congestion in my chest, a little bit, something is just gathering up here. So I'm just inviting you to pay attention to your body just for like a minute and recognize what's going on. And while you're doing that, I'll make sure I have the screen set up so I can see as many of your faces as I can. Okay. So wherever you are, whatever you're feeling, I want to invite you to feel your arms and legs. So now kind of gently stop paying attention to whatever is happening, probably, in your trunk or your head, and just bring back your arms and legs back to your whole body sense. And you can begin with sensing your hands and feet, and then sensing the whole legs, the whole arms. And then take a moment to orient yourself kind of back in the room. Actually, I invite you to open your eyes and just let them look anywhere they want to look around your room. Just notice a couple spots in your room. Doesn't matter what, doesn't matter where you look. Like it's almost like you just let your eyes to wander, roam around your room. You can turn your head left, right, up. Notice the lighting, the colors, but just kind of scanning. And when you just completed that little circle, you just can come again to the center and look at the screens or close your eyes, whatever works for you. So this is my fourth time and last two times I spoke about polyvagal theory. And this is something that I'm studying, somatic experiencing. And I would like to continue with that. So instead of one long experiential meditation, I would like it to give you some pocket change. And that pocket change is going to be a magic pocket change. If you want to use it and spend it, you're gonna have more. So use it and spend it. And then you're gonna find more in that pocket. So in that sense, it's magic. So what I call change is just a few tricks, tools, or kind of a guiding points. And actually what we just did was one of them. Sensing legs and arms is a really nice, well, practice that we can do when especially when we feel overwhelmed. So a lot of times we hear that if we want to be present and want to kind of be balanced, we need to use belly breathing, and that's all fine. But sometimes even that could be kind of overwhelming. We could have, some unsettling sensation in the belly too. It might take a while to. So it might be a little bit difficult to work in the core. So for that situation, it's very useful to bring in sensation in your legs and arms. So it's just kind of makes you feel present and makes you like inside of your full body, including hands and legs, because oftentimes we just lose contact with them when we focus on the trunk or things are happening in the trunk, in the chest or belly or head. So yeah, so that was one tip that I wanted to give you. And there's just a few more. But before that, I just wanted to really quickly review why we're doing that and what polyvagal theory teaches us. So this is just a really interesting information about how our nervous system works, especially autonomic nervous system. And then, so in old times, we used to think that we have sympathetic and parasympathetic, kind of something, activating and something relaxing. So now we seem to learn a bit more about that, and we are in polyvagal theory, which means polyvagal means more than one, right? Poly. So we're talking about kind of 3 states, and I'm simplifying it here, and we talked about about that before, but I just want to refresh that. So we have sympathetic part of our nervous system response, which is what we're going to call red, which is activation, increased heart rate, and etc. It's kind of red zone. And S stands for sympathetic, S stands for stress. So and stress could be actually nice. It could be good. It could be something we're just excited to do, like sports or something we're just really engaged and there's a lot of physical activity. So it could be just fun, or it could be threat response. Then it's combined with fear. And then we have, so that's a red zone. And then we have deep relaxation, dorsal vagal branch of parasympathetic nervous system. Dorsal stands D. I call it blue zone, and that's associated with the word deep. So it's a deep relaxation. When it's regulated, it's like deep sleep, deep meditative states. Just when you just lay down, relax, listen to music, and don't want to move a finger, that kind of thing. Again, it can be mixed with the fear, and it could mean like a freeze response and dissociation, depression, when we're really not in touch with our body at all. So that's blue. And then in the middle, there is a ventral vagal, V, let's call it like a vowel zone. It's green. And that's what we call home. That's where we spend the most of the time. That's where we kind of relax, but engaged, we're connected. So what we want to do with in our life, we want to increase our coherence, how our body works, so we can spend the most time in that green zone, become activated when we need to or when we want to, become really relaxed and rested when we need to or we want to, and do not get stuck too much in the blue or not for too long in the red. So the green. So we're working on all these tools gonna help us to go back to green when we need to. So that's basically what we call self-regulation, and that's what increases our coherence, which means everything in our body works as it's supposed to work, and we're just healthier. And also it increases something we call the window of tolerance. So whatever happens in our life, we're just manage pretty well. So let's go back to our change in the pocket. So there are two types of a change I'm going to tell you about today, and some of this we're going to experience. So anchors and glimmers. So I'm going to do anchors first and then glimmers. So anchors is something that, like a tool we can use to help us self-regulate kind of immediately. And there are a lot of, possible anchors, and some work, better for some people, others work better for other people. So it's a huge, basically, right? It's like a palette. So one, I'm just going to mention three today. Let's say three. So one, sensing your legs and arms. That we already done. So second, if you, of course, you know a lot of breathing practices, that, again, there's a lot. There's some box breathing, just, deep breathing, counting breath, just numerous amazing practices. What I suggest you remember just one thing, and you can practice it, and to understand that it's important to be able to track where you are. So if you feel stressed and overwhelmed, when we feel stressed and overwhelmed, and we are kind of hyperactivated, so we're in sympathetic mode in red. So our heart rate is a little faster. We could be experiencing, anxiety, or we are worried, or we are just the whole day we're kind of in that feeling on the edge, irritated for no obvious reason, just like trying to keep the lid down. So those states that we need to really bring more blue, right? And adding, excuse me, adding a little bit more blue will bring us to green, to the center. Or we actually can be in the blue. We could feel overwhelmed and sluggish, just like we want to do. We can't find any energy to do anything. Just don't care, just procrastinate, postpone, just can't do it, just need rest. So that's a blue zone. So for blue, we're going to add a little bit activation. We need to activate a little bit to bring us to the center. So with any breathing practices, just remember, when we inhale, when we do something, more attention to inhalation, a longer inhalation, more forceful inhalation, deeper inhalation, anything with inhalation is gonna activate us. So any breathing practices that puts focus on inhalation is gonna wake us up. And the opposite, anything that done on exhalation, a longer exhalation, slower, deeper count on exhalation is gonna bring us to, just gonna calm us and bring more to blue. So that's how to use that, any breathing practices. So first you sense where you are, which part, left or right, kind of red or blue. Do you wanna bring more energy to your system, or you wanna disperse energy? And that's how you can use breathing practices. And maybe for a moment, we can just slow down and sense ourselves. And just ask ourselves, like, where you are right now. Could be in the green just as well, or it could be a little bit more towards red, activated, or towards blue. So again, blue is more like sluggishness, lack of energy, feeling low, slow, maybe heavy, a little bit dissociated, hard to feel, hard to actually sense. And red is more like jittery, more tense. So that's a little bit easier actually to feel, because we're not in that state, then we're not shut down. So we're kind of more open to sensations. So yeah, just notice, just track where you are. And then take either deep inhalation or deep exhalation, depending on where you are. All right, so back to your normal breathing, whatever it is, for a moment. And anchor number 3, I'm going to mention today, is voice. Voice is really important for vagal tone. It's really important to really get in touch with the green, because that's green is where we are open to contact, communication, connection. So voice is really a great tool. So just think, like, when you hear the voice, it affects you. It affects you in a certain way. What kind of voice affects us in a kind of relaxing mode, like lower tone, right? I don't know if I can really do that, but if I let's say lead the meditation, I would probably use a little bit lower voice, a little bit slower voice, and that's gonna come along with calming myself and whoever listens to me down. Yeah. So if you can use, like, listening to the voices that have this quality, that could be handy. You know, certain podcasts, certain audiobooks by people who have beautiful voice, and usually it's a deep, like, velvety voice. It's we like it. We want to listen more of this, right? So, and it's like, no doubt, because it has a very direct effect to your nervous system. So you can use that tool. I remember even people sometimes would tell me when I lived in New York City, although it could be here in DC, people were discussing that there are some conductors on their subway lines that use very, beautiful low voice to announce stops. And people tell me, like, every time I go back home from work, I really hope I get in a train with that guy or with that woman who used that kind of voice. So yeah, it's pretty magical, right? And you can use your own voice too. So any kind of, humming, murmuring is actually toning the vagal nerve. And again, you can, depending on where you are, more in red or more in blue, you can use certain modulations for your own voice. Let's say if you want to, calm right before bed, you can use like humming and chanting in a lower voice. Or let's say if you're like on the couch and you just want to watch movies and you just can't make yourself to get up and do something that you really need to do, but all you can think is like that ice cream in the fridge, you could just say, "Hey, refrigerator, why don't you eat that ice cream yourself, for God's sake?" So make it sound funny in a high-pitched voice, or like talk to your pet in a really like exaggerated high-pitched voice. And that's actually amazing too. It's like you can really get into that. Okay, so that's about voice. So listening and also using your own vocal cords. So these were anchors. And I want to talk a little bit about glimmers. So glimmers are micro moments, not movements, micro moments of regulation. So it's just throughout the day, each of us, all of us, maybe not every day, but definitely probably most of the days, we feel these interesting moments when something just feels like all of a sudden we notice something. It makes us feel just right. Just like a teeny tiny moment that everything is perfect. So I don't know if you can really like, let's just give us ourselves, let me finish the explanation, and then we'll try to get in touch with those, like remember how they feel those moments. Like a spark of something that's beyond even explanation. It's almost like existential moment when like a carpe diem, when you notice someone's smile, when you notice like a flower, when you notice, it could be anything in nature, or like something visual, something auditory, could be a bird singing. And all of a sudden you just stop and you just like, yes, it's almost like, yes, that feels just right. So that's when our nervous system is actually very, very regulated. And the other thing that I find for myself that makes me feel that when I encounter synchronicities, something just like all of a sudden, like there is a coincidence, and it could be totally meaningless. It doesn't matter. It's not like somebody made you feel good. That's obvious. You feel good, but it's like you feel good for no reason. So we call them glimmers. And what I suggest to do is just to simply notice them as you go through the day. Just make a note and just call, oh, glimmer, another glimmer, another glimmer. And that's just gives your nervous system a chance to actually kind of learn and be more in that state. And let's just take a minute or two just to close your eyes if you want, and just think of what kind of glimmers maybe you remember you experienced recently. Okay. So the last thing I want to mention in as a part of the glimmers actually is that state where probably you are right now, I hope. It's like open-ended curiosity. Open-ended curiosity is a state that is totally green. So every time you feel curious, just for the sake of curiosity, without, you don't need to find answers, you're just curious and open. Those are really precious states of actually very regulated state of nervous system. Okay, so I guess that's all I wanted to share with you guys today. So again, it was a lot of presentation, but I do hope that you can remember about this change in your pocket when you need it and practice these small things. And the more you spend this change, the more you find in your pocket. So again, what I talked today was about some anchors, like sensing legs and arms, breathing in and out, activating and calming, using voice, and noticing these micro glimmers.
Thank you, Angela, so much. I hope everybody enjoyed this rather unusual presentation. I think it's very profound, and I hope Angela will come back soon to do more. There were two series of questions, but it's 2:57, and I really hate to put us back in a booster mode. So I think we'll keep them. Al and Benita, if you guys don't mind saving the questions, although, I'm actually going to copy paste them for myself and make sure that we address them next week. Have a wonderful weekend. I hope you enjoy the great weather, and yeah, unless there's a questions for Angela, I actually want to hold off if maybe somebody have mind-body related questions. You're going to give it a minute for that.
I think there was a question for Angela.
Yeah,
about breathing.
Linda asked, I answered her privately. She
Okay.
in exhalation and is in exhalation in this practice is through nose or mouth. I said probably nose, but probably doesn't matter. But I don't know if you want to add to that.
I just wanted to underline the most general principle, but within each way, there would be multiple practices. But I think for most part, I would say nose is the safest way to use this kind of breathing, if it's just concentrating on in and out. But it's just a much bigger topic. So, but every breathing practices you take, it's going to fall into one or the other category. It's going to do something to your nervous system, unless it's very balanced and it's like a series of of different breath. Maybe we can talk about this more, right, Misha?
Yeah, I think it's a good idea. I think it's a good for the next time when you come back to do it. I'm having a hard time.
Let's break down breathing.